Anita, thank you very much for being here. I'm sure you're quite busy these days. I was taking a look at some statistics on campus. It appears that students have a positivity rate of about 35%, faculty and staff about 10%. And Howard made the decision recently to push back the start date for the semester to January 18th, and everyone who returns has to have a PCR test, a negative PCR test within 4 days prior to arrival. Also worth noting that 99% of students were fully vaccinated in September. Given all of these factors and what Dr. Fauci was saying about things getting better maybe by the end of January, how are you looking at the semester with regard to safety on campus?
So Howard University, I'm the CEO of the hospital. Howard University is being safe. We have to continue to make sure that we isolate our students and patients and our community to make sure that this fast-spreading Omicron does not spread any further. It is just wisdom and caution that the university is keeping the students away as they've come home from Christmas, keep them away from gathering together and so keeping the spread down.
How would you describe the sentiment surrounding the doctors and nurses and staff members at the hospital at this point in time? You know, we hear that things will get better in January. We feel like we've heard that before, of course. Here we are about 2 years into the pandemic. How is morale at this point in time?
We are working every day as leadership and as hospital organizations with DC Health and DC Hospital Association to address just that. Our teams are tired. This has been just a long, drawn-out process. We have as many patients today, close to as many patients today with COVID as we had a year ago. And so we are fighting that same fight again. What's different is we have less critical patients, but it is still filling up our hospital walls. We're doing everything we can to make sure that we have enough staff, enough agency staff to make sure that we can give our team time off, but it's a lot of work.
Anita, this is Scott. It's nice to see you.
Hi, Scott.
You've spoken quite honestly and thoughtfully over the last many months about distrust of vaccines in some parts of your community, in the African-American community. You faced some controversy within the community for supporting the vaccine. And I'm just curious, when you hear someone like Dr. Kavita Patel, who came on Squawk Box this morning, a former White House official, basically say that the messaging of the vaccines from the start was flawed, and had public officials from the outset been very clear that vaccinations were not meant to stop COVID from infecting you. It was meant to keep you from the hospital and from suffering severe disease. I'm wondering, as a public health official yourself, as a CEO of a hospital, how you think about that and just reflect on where we are today relative to where we could be in terms of vaccination numbers.
That kind of language might be true. However, we had no idea how COVID was going to act and how COVID was going to respond to our patients in our community. We certainly knew that we had to advocate for vaccinations. Vaccinations are still, whether you look at it retroactively, vaccinations are still our best weapon against controlling COVID, against controlling the worst of the disease process.
What do you make of this kind of debate over what it constitutes to be fully vaccinated? Howard has decided to require a one booster, third shot to return to school. What has been the response from the student body and faculty over that decision?
So I can't speak for the student body. I can speak for the employees and us at the hospital. We do know and we follow the science. The science is telling us that it gives us an added protection and an added layer. What we do know is that it is not perfect, but it certainly helps. And if it helps, that's the direction that we're going to go. We follow the science that the CDC is giving us, and the CDC is working very hard to stay current and give us current information.
All right, Anita, thank you very much for joining us. We appreciate it.
It's been my pleasure. Thank you.